On my first speaker, Dr. Sanjeev Deva. He is New Zealand trained medical oncologist who works at the Auckland Hospital. Completed his medical oncology training in Auckland in 2010 and then completed clinical fellowship in experimental oncology at Guy and St. Thomas Hospital in London, UK. Sanjeev returned to Auckland in 2015 as a medical oncologist. He has also established the Auckland Cancer Trials Center at the Auckland Hospital and is the current medical director. He is a principal investigator on many groundbreaking studies and has collaborated with New Zealand leading researchers. Sanjeev is sought after lecturer, is invited speaker at national conferences, and is widely published in peer-reviewed journals. He prides himself on clear communication and making sure his patients receive the best multidisciplinary care. Ladies and gentlemen, I give you Dr. Sanjeev Deva. Do you want the microphone in hand or?
Yeah. Thanks for that generous introduction. It sounded far too kind. I just wanted to sort of echo those sentiments. Thanks for everybody coming out tonight, for raising money for a charity that's, I guess, very close to my heart, given what profession I'm in. But I assume it's close to many people in the crowd as well, because breast cancer is a very common disease, and I'm sure many of you in the crowd would have friends, family, aunties and daughters and sisters who may have been affected by breast cancer. And it's only by raising money and doing research so we can do better in our next attempt at treating breast cancer that we get any better and improve the outcomes for this difficult disease to treat. So I thought, I've got 15 minutes to talk to you about breast cancer. That's quite daunting, but I thought I'd talk about a little bit about it, but then I thought again, well, let me see if I can tell you everything I know in 15 minutes. So it's going to be a whirlwind of oncology, and we'll try and see if we can make you all budding oncologists in the next 15 minutes. So if we could just... I had a few slides, but I didn't realize the screen would be so small, but it still reminds me what I wanted to talk about, so just bear with me as we get the slides on. So I think the first thing I wanted to talk about is the New Zealand Breast Cancer Foundation, actually. They're an amazing organisation. In terms of charities we have in New Zealand, they do a lot of good work. The advocacy they do for patients, the education they do for family members, the promotion they do to the government in order to try and get drugs funded or treatments funded in New Zealand is incredible. The Breast Cancer Foundation funds fellows in my department. They fund research projects that I do. So you know that the money is going a long way to making sure that New Zealand patients keep up with what's happening in the rest of the world, so the outcomes are just as good in New Zealand as they are elsewhere. Still going? Okay. The next thing I wanted to talk about is, I guess, what I think cancer really is. So for many people, they don't really understand cancer, and it just seems like a horrible disease, and they just don't want to hear the term. But what a cancer is to me is just essentially a rogue cell that's gone bad. Your body is made up of billions of cells that make up your body, and then they have to divide and replenish themselves. But sometimes when they divide, the information that gets transferred from one cell to another, it doesn't happen correctly. There is what we call a mutation. And that mutation results in a growth advantage, and that cell becomes very rogue. It starts growing very quickly, and then it has the ability to grow very fast and take over the organs that it's in, and then spread throughout the body. And this is what causes it to be such a devastating disease. And I guess when we think about how did we get to where we are today, we have to think where we came from. Now, if we go back through all of medicine, we start back in one of the initial doctors, was a Greek philosopher known as Imhotep. He was knocking around about 2500 BC, and he was the one who was accredited with writing one of the first textbooks. And in this textbook, he had 46 different diagnoses. And one of the diagnoses was a lady with a woman who had a very hard lump in her breast. And under the treatment he had for this, he wrote, "There is none." So even back in 2500 BC, there was a case of a breast cancer, and they even knew at that point in time that was very difficult to treat. we skipped forward into the sort of 1800s, and there was the advent of antibiotics and anesthetics, and all of a sudden we can do better for treating cancer than giving potions and tinctures and different chemicals. So at that point, we had general surgery, and so patients would then turn up to a surgeon with a breast lump, and they would have it excised because we had the ability to give a general anesthetic and also an antibiotic to allow them to recover without getting very sick. And so this made a very big advance in breast cancer. Now, patients who had breast cancers would have their breast lump removed. So this was a major, advance in terms of breast cancer treatment. And so from that point on, surgery became the mainstay of how we treated breast cancer. The thought was then, at that point in time, the bigger the breast operation, the more likely we would have a chance at success. So patients would undergo more and more big mastectomies and have whole chest wall removes in order to try and cure the breast cancer. But unfortunately, there was a limit to this because it was very clear then that the breast cancer was not only contained in the breast, but that it had the ability to spread. And so this was the problem with breast cancer and many cancers, is that not only does it grow in the organ that it starts from, it has the ability to what we call metastasize or spread into a different organ. And so if we take a biopsy of a tissue that has gone to a different organ, it looks like that abnormal growing breast tissue from the original breast lesion. So it's not that you've developed a new cancer, it is just this original cancer has the ability to spread around the body. And so at that point, we knew that surgery on its own couldn't be good enough to treat the cancer. We needed to look for other avenues for treatment. And that's where chemotherapy came along. Chemotherapy was a little bit of an accident. It was a sort of chemotherapy, the discovery of chemotherapy was accredited to an incident in World War II where the German Luftwaffe destroyed a group of boats off the coast of Italy, and on the boats was a sort of a stockpile of mustard gas. And the mustard gas blew onto the shores, and then they realized that some people died straight away, but there was a number of people who died 2 or 3 weeks later, and they had no more bone marrow, the lining of their mouth had disappeared, and the lining of their gut had disappeared. Whatever this mustard gas had done, it had the ability to destroy certain cells in the body. And they were very interested in the fact that it destroyed the bone marrow. And then the idea was, can we use this mustard gas in a concentrated form to treat a blood cancer? And that was really where the advent of chemotherapy came, was an incident from World War II where they realized that the toxicity of this mustard gas could reduce your white blood cells. And then we started using chemotherapy, and we became more sophisticated and used different chemotherapies and using very high-powered medicines which essentially just try to kill any cell that's trying to divide, which is a cancer cell at its origin. The problem with it is that there's so many other cells in the body that also divide and try and replenish. So hence that's why we have so many toxicities related to chemotherapy. And I think we're going to hear from Elizabeth later on in the evening, and she'll talk about her experience of going through breast cancer, and she'll give a much better detail about the toxicity related for having treatment related to breast cancer. And it can be very tough. And you have all these different side effects that you can see on the board. People have diarrhea, they lose their hair, they can be exhausted, they continue to vomit, they have bad mouth ulcers, they're very susceptible to infections. So it's not these treatments that patients have to undergo in order to try and improve their outcomes from this difficult disease. The medicine is almost as tough as the disease at some points. Next slide. So for a lot of times we were using surgery to cure the disease, and then we knew that chemotherapy had some benefit, but we wanted to know how we could do any better. And really, the mainstay of improvements in cancer outcomes in the last 30 years has been because of basically 3 things. One is early detection. We knew that if we can get the cancer early, we can cure it early, and we won't need these toxic medicines like chemotherapy and surgery. So screening programs were developed. And the whole point of screening is if we can find the breast cancer where it's very tiny, it's very likely to be cured. And so, we encourage everybody who is eligible for, breast cancer screening, please do so, because your best chance of fighting this disease is to find it when it's very small. When it's metastasized, we're in a very difficult scenario. But that's one way we've been improving on cancer outcomes. And the other is, where I work, which is improving the drugs we have for cancer, looking into new trials, new chemotherapies, new ways of targeting cancer cells, and, we hope to improve cancer outcomes for all sorts of patients. So I don't know if you can see this table, and it doesn't really project very well, but if the bottom three graphs, you can see that there's what's got localized, regional, and distance. And the blue bar is your likelihood of surviving 5 years if you're diagnosed with this cancer. And so you can see if you have localized cancer, it's upwards of 90% chance of being cured or alive in 5 years, which is effectively cured if you're diagnosed early. If it is spread locally, just to your local lymph nodes, it drops down a bit. But when it's spread to a different organ or metastasized, your 5-year chances are only 25%. Now, those odds are much better than they used to be even 30 years ago, hence our improvements with breast cancer outcomes. Next. But a lot of my work, like I said, is trying to figure out how we can do better. So, at Auckland Hospital and at many hospitals around the world, there's lots of work going into, what underpins the cancer and what makes a cancer. And through advents and understanding that cancer is a genetic disease and sequencing technology, we can understand the exact mutation that an individual cancer had and see if we can have a targeted treatment that will attack that particular Achilles heel. So chemotherapy has now evolved. We not only have those tough medicines or essentially poisons that I talked about, but there's also targeted therapies and there's also immunotherapies on the horizon. So the future for breast cancer treatment looks a lot brighter, knowing that in the last 10 to 15 years, there's been a significant advent in the way we can attack a breast cancer cell. But it does take us some time to get there. And the only way we can get there is with research, and research is expensive, and research is often not funded by the government, and hence the importance of evenings like tonight, where we can raise money to help patients get onto clinical trials or help clinical trials start, and hopefully we can hope for a better tomorrow. And the goal for us, I guess these are my two take-home messages from today. One is that we hope to diagnose cancer earlier. So if you have the opportunity to be screened for your breast cancer, please do, because we want to try and find this cancer early. If we find this cancer early, it's a very curable and a very treatable cancer. And in addition to that, I also want you to empty your pockets, because not all women are in the position that they find the cancer early. And the dismal 5-year outcomes mean that we continue to work hard so we can improve the outcomes of this cancer. So that's all I really wanted to say. So thanks for the opportunity today, and thanks for everybody turning out, and I hope you go well at the auction and the raffle. Thanks a lot.
Thank you, Doctor.